For decades, psychedelics were labeled taboo, linked with counterculture and controversy. But today, science is revisiting these powerful substances with new eyes. From treating depression and PTSD to helping people confront trauma and addiction, a quiet revolution is happening in mental health research. This is psychedelic-assisted therapy, a frontier where psychology, neuroscience, and ancient wisdom meet. Welcome to Psychology Threads. Let's explore the mind-bending world of psychedelics and how they might reshape the future of therapy. Psychedelics aren't new. Substances like psilocybin, the active ingredient in magic mushrooms, and LSD were studied intensively in the 1950s and 60s. Psychiatrists believed these compounds could unlock the subconscious, helping patients process trauma and existential distress. But when psychedelics spread beyond laboratories into popular culture, fear and politics took over. By the early 1970s, most psychedelics were banned worldwide, halting decades of promising research. Fast forward to the 21st century, neuroscience and modern psychiatry are once again turning their attention to what might be one of the most misunderstood tools in mental health. Unlike recreational use, psychedelic-assisted therapy happens in a controlled clinical setting. Patients are guided by trained therapists, often with medical supervision, while taking substances such as psilocybin, magic mushrooms, MDMA, commonly known as ecstasy, ketamine, a legal dissociative anesthetic sometimes used off-label for depression. These sessions are not about tripping. They are carefully structured experiences combining the psychedelic state with psychotherapy, allowing patients to explore emotions, memories, and beliefs in ways traditional talk therapy sometimes can't reach. So what's happening in the brain? Research using fMRI scans shows that psychedelics temporarily disrupt the brain's default mode network, the system responsible for self-referential thoughts and the ego. This can create a state of ego dissolution where a person feels connected beyond themselves, reducing rigid thought patterns associated with depression and trauma. At the same time, brain regions that don't normally communicate start synchronizing in new ways, creating what some researchers call neural flexibility. In essence, psychedelics seem to reset the brain, offering patients a window to break free from deeply entrenched patterns of fear, shame, or rumination. The results are hard to ignore. Clinical trials from institutions like Johns Hopkins University, Imperial College London, and the Multidisciplinary Association for Psychedelic Studies, MAPS, show remarkable outcomes. Psilocybin has helped patients with treatment-resistant depression experience rapid and lasting relief after just a few sessions. MDMA-assisted therapy has shown unprecedented success rates in treating PTSD, especially among veterans and trauma survivors. Ketamine clinics, already legal in many countries, offer new hope for those who haven't responded to antidepressants. For many participants, these experiences aren't just chemical, they're deeply emotional and spiritual, often described as life-changing. But with potential comes caution. Psychedelics are powerful and unpredictable. Without proper screening and guidance, they can trigger panic, psychosis, or distressing experiences, especially in individuals with certain psychiatric conditions. There are also ethical challenges. Who should guide these sessions? How do we ensure safety, consent, and accessibility without commercialization overshadowing compassion? And perhaps the biggest question, are we ready as a society to integrate substances once feared and banned into mainstream medicine? The tide is shifting fast. In 2023, Australia became the first country to legalize MDMA and psilocybin for specific psychiatric treatments under medical supervision. In the United States, the FDA has granted breakthrough therapy status to several psychedelic-assisted protocols. If the momentum continues, we may soon see these treatments becoming part of the standard mental health toolkit, alongside therapy, mindfulness, and medication. But researchers emphasize this is not a magic pill, it's a catalyst, a tool that, when paired with therapy and integration, helps the mind heal itself. The journey of psychedelic-assisted therapy is just beginning, and with it, a deeper question emerges. Can altering consciousness help us understand consciousness itself? As science explores this next frontier, one thing is clear. The future of mental health might look very different from its past. This is Psychology Threads. Thank you for watching. If you found this video insightful, don't forget to like, share, and subscribe for more explorations of the human mind.